Hello, my name is Brittany Torrijos, and my presentation today will be on the topic of Godfrey Oakley and the fight to prevent spina bifida with folic acid. Spina bifida is a birth defect involving incomplete development of the neural tube of the fetus. The neural tube is the embryonic structure that eventually develops into the baby's brain and spinal cord. It forms early in pregnancy and closes by the 28th day after conception. Spina bifida may result in paralysis, bladder and bowel problems, as well as physical and intellectual limitations. The correlation between folic acid intake and development of spina bifida commenced when Nick Wald conducted a clinical trial which showed that women who consumed 4,000 micrograms of folic acid before and during the early weeks of pregnancy had a 72% lower rate of spina bifida. Immediately following the results of this trial, the CDC recommended that all women of childbearing age consume 400 micrograms of folic acid daily. Godfrey Oakley and his team took this a step further by pressing the FDA to require fortification of flour. The strength of the situation is that with proper folic acid intake, spina bifida can be prevented. The weakness is that many women may not know that they are pregnant. Half of all pregnancies in the United States are unplanned. The opportunity then becomes to educate women on the importance of taking folic acid daily prior to conception. The threat is that spina bifida is more likely to develop without the proper folic acid intake. The Spina Bifida Association is the only national voluntary health association solely dedicated to enhancing the lives of those with spina bifida through education, advocacy, research, and support. Because of their outreach campaigns, countless women understand the importance of folic acid. Each year, 1,500 babies are born with spina bifida. Hispanic women have the highest rate of having a child born with spina bifida at 3.80 per 1,000 live births. Because there is no known cause for spina bifida, our core priorities are to prioritize education by emphasizing the importance of folic acid intake and to prioritize prevention because it is a preventable disease. A study which analyzed spina bifida before and after the folic acid mandate found that, due to the mandate, spina bifida prevalence declined by 31%. Two approaches cited to increase folic acid consumption were 1. To fortify foods with folic acid. In addition to the previous flour fortification mandate, in 1998, fortification of all cereal grain products went into effect. And 2. Using dietary supplements such as multivitamins and prenatal vitamins. We can apply the health belief model to this case. If women are properly educated on the importance of folic acid supplementation or the perceived benefit and the dangers of spina bifida, this perceived threat, as well as what they need to do or the cue to action, they will more likely take the supplements. One recommendation is to require all women to have an annual exam with their primary care provider. Included in this should be a discussion of the importance of folic acid, especially for women trying to conceive. My second recommendation is that all women of childbearing age should be required to take a multivitamin. The action plan starts with healthcare providers. They need to spearhead the prevention of spina bifida. By 2020, all women must be required to visit their primary care doctor for an annual exam at least once a year. By 2025, all women who are of childbearing age and who are intending to become pregnant must be required to take prenatal vitamins. And by 2030, prenatal vitamins should be offered free of charge to women who are or intend to become pregnant. In my opinion, prenatal care is very important and every woman should be entitled to it. Prevention and education are so important to combating spina bifida, and I think that all women should be required to take a multivitamin if they are of childbearing age, and if they cannot afford it, it should be provided to them by the government. Thank you for listening to my presentation.